Hey everybody, welcome to Aaron's wonderful world of dentistry. I'm just kidding. My name's Aaron from Dr. Mark Harris's dental office in Riverside, and this video is for caregivers and senior citizen patients who might be having trouble with oral hygiene. The CDC states that 2 out of every 3 adults aged 65 and older have gum disease. Inflammation of the gums results in bone loss, and that's something you can never get back. Periodontal disease cannot be cured, but it can be managed, similar to diabetes. Our immune system is critical for keeping us healthy when faced with fighting things like COVID-19. A healthy mouth allows our immune system to be at full capacity when faced with attacks upon it. Let's jump into our first of 4 topics, which is flossing. Flossing is the most critical step to a healthy mouth. Many people with physical limitations cannot perform this manual task properly. Flossing should always be performed before brushing in order to extract any plaque, which will then allow the toothpaste to penetrate the areas that could have been hidden by plaque buildup. Many people find it difficult to floss their own mouth, let alone someone else's mouth. For this, there's a tool called a Waterpik. First, you're going to want to acquire about a 10-inch piece of floss, which is about that long. And there are 3 steps to flossing, but most people only perform step 1. So step 1 is to break through the contact of the teeth like that. Even if the contact is wide open, still move the floss in between the teeth to position yourself for steps 2 and 3. So step 2 is to release the tension in the floss so that the floss goes into a C shape, something like this. And you're going to go around the tooth and scrape up on the tooth from the gingival portion, or where the gums are, up towards the biting surface of the tooth, extracting any of the plaque. What we're not going for is a saw back and forth along the gums. That's not what we want to do. Step 3 is to do the same thing, but on the tooth right next door as you did with the previous tooth. All right, buckle up your seatbelts because we're moving fast. On to the next topic, which is using an oral irrigation device, otherwise known as a Waterpik. For many people, flossing can be difficult. A variety of physical limitations, such as arthritis or weakened manual dexterity, can make flossing impossible. For example, if someone has large hands that cannot fit entirely into their mouth, Waterpik makes an oral irrigation device for that. The device is like a miniature pressure washer designed to remove any debris in your mouth which causes infection and disease. The brand is Waterpik, and the model we like is called the Aquarius. It costs somewhere around $70. There are other companies and devices with a range of prices to match your budget. All of the instructions can easily be followed by a patient or a caregiver. We have found that water picking to be very effective, even more so than brushing. First, fill the tank with some lukewarm water, and you can add some salt for an added therapeutic effect, but it's not required. The patient should be close to a sink or a catch can. That way any excess water that's expelled by the device and debris is not making a mess. Generally, for cleanliness, we recommend that the patient's lips are pursed around the tip. Once the tip is in the patient's mouth, proceed to Waterpik along the gums in this fashion, all the way around the front and the tongue side of the arch. And proceed to do not only the bottom, but the top arch as well. If the treatment is uncomfortable, you can always turn the pressure down. And if water is going everywhere, have the patient gently close their lips over the nozzle. If salt was used, flush the unit with water in order to flush out any residual salt that has been left behind. Regular weekly maintenance with appropriate disinfectants is also encouraged. Now we're moving on to our next topic, which is brushing. When brushing, always use a soft bristled toothbrush because hard bristles can irritate the gums and even cause them to recede. You'll also want to keep in mind that you only want to apply a pea-size dollop of toothpaste to the bristles. Begin by brushing in circular motions, working your way across the entire mouth. Something else you want to keep in mind is that we don't want the bristles to be perpendicular to the teeth. We actually want them to be at a 45-degree angle. That way the bristles can excavate any of the plaque that is located underneath the gums. Brushing your teeth should be done relatively gently. We don't need to be getting an arm workout when we're brushing our teeth. Once you've done all the surfaces of one arch, move to the opposite arch. And each arch should take about 1 minute. Many people use toothbrushes to clean their tongues, but toothbrushes are designed for hard surfaces like teeth. Instead, buy a tongue scraper that looks like a mini squeegee. You'll want to start at the back of the tongue and scrape forward in a motion just like this. We're moving on to our next topic, which is denture maintenance. Before removing the dentures out of the mouth, you'll want to set up your maintenance tools. And for this, we'll need a bowl, a denture-specific cleaning brush that has never seen toothpaste, as well as cleaning tabs. Here at Dr. Harris's office, we recommend using the retainer bright. The next step, you want to fill the bowl with enough water to completely submerge the dentures. And then after that, we'll take one of these cleaning tabs and you can just drop it right into the bowl. This process should take roughly 20 minutes as soon as you submerge the dentures into the bowl. All right, after our dentures have been soaking for 20 minutes, we're gonna take our brush and we're gonna gently brush all surfaces of the denture and then rinse them off with clean water. If you might be wondering why I haven't mentioned using mouthwash, it's because most commonly used mouthwashes are an alcohol-based mouthwash. Since a large portion of our patients over the age of 60 suffer from dry mouth, alcohol-based mouthwashes will increase dry mouth symptoms. Dry mouth is not good for our teeth because they need to stay hydrated, like a well-oiled machine. If one must insist on using mouthwash, make sure it does not have alcohol in it. If anyone has any questions, please do not hesitate to reach out to us. Our contact information is attached to the link below, and we are here for you. Thank you for listening, and we hope you have a wonderful day from all of us here at Dr. Harris's office.